If you're feeling tired, depressed, and can't seem to get out of bed in the morning, it may be a warning sign that you're lacking vitamin D. In this video, I'm going to tell you exactly why this might be happening and also give you 10 warning signs of vitamin D deficiency. Welcome to Snap Reads, and I'm an expert in this field. Over the years, I've helped numerous people identify the signs that they may be lacking in vitamin D, and today I'm here to share my experience with all of you. So tune in as I go through some common symptoms that indicate a deficiency and how to take corrective action before it gets critical. 10 common symptoms of vitamin D deficiency. Fatigue and low energy levels. Feeling tired and exhausted even after a good night's sleep could be a sign of vitamin D deficiency. If you find yourself constantly lacking energy, it's worth considering your vitamin D levels. Frequent infections and weakened immune system. Vitamin D plays a crucial role in supporting the immune system and fighting off infections. If you find yourself falling sick often or having difficulty recovering from illnesses, your vitamin D levels may be at fault. Muscle pain and weakness. Deficiency in vitamin D can lead to muscle pain and weakness. If you experience unexplained muscle aches or notice a decrease in your muscle strength, it could be a warning sign. Bone and joint pain. Vitamin D is essential for calcium absorption, which is necessary for maintaining healthy bones and joints. If you experience chronic pain in your bones and joints, it could be a sign of vitamin D deficiency. Depression and mood swings. Vitamin D is known to play a role in regulating mood and preventing depression. If you find yourself feeling down or experiencing frequent mood swings, it's worth considering your vitamin D levels. Hair loss. While hair loss can have various causes, vitamin D deficiency is one of them. If you notice excessive hair loss or thinning, it may be worth getting your vitamin D levels checked. Slow wound healing. Vitamin D is involved in the wound healing process. If you find that your wounds take longer than usual to heal, it could indicate a deficiency in vitamin D. Impaired cognitive function. Some studies have suggested a link between vitamin D deficiency and cognitive decline. If you notice difficulties with memory or concentration, it may be worth considering your vitamin D levels. Increased risk of chronic diseases. Vitamin D deficiency has been linked to an increased risk of chronic diseases such as heart disease, diabetes, and certain cancers. If you have a family history of these conditions or are at a higher risk, it's important to ensure your vitamin D levels are sufficient. Weakened bones and increased risk of fractures. As vitamin D is necessary for calcium absorption, deficiency can lead to weakened bones and an increased risk of fractures, especially in older adults. If you have a history of fractures or notice your bones becoming brittle, it's worth checking your vitamin D levels. Importance of vitamin D in the body. Vitamin D is an essential nutrient that plays a vital role in various bodily functions. It helps in calcium absorption, which is crucial for maintaining healthy bones and teeth. Additionally, it supports the immune system, prevents chronic diseases, regulates mood, and aids in maintaining optimal muscle function. When your body lacks sufficient vitamin D, it can lead to a range of health problems. Let's explore the common symptoms of vitamin D deficiency that you should be aware of. The role of sunlight in vitamin D synthesis. One of the primary sources of vitamin D is sunlight. When your skin is exposed to sunlight, it produces vitamin D through a natural process. Sunlight contains ultraviolet B, UVB rays which interact with a substance in the skin to produce vitamin D. However, the amount of vitamin D produced through sunlight depends on various factors such as the time of day, season, geographical location, skin color, and sunscreen use. It's important to note that while sunlight is an excellent source of vitamin D, excessive sun exposure can increase the risk of skin cancer. Therefore, it's crucial to find a balance between getting enough sunlight for vitamin D synthesis and protecting your skin from harmful UV rays. Risk factors for vitamin D deficiency. Certain factors can increase your risk of vitamin D deficiency. These include limited sunlight exposure. If you live in an area with little sunlight, spend most of your time indoors, or cover your skin with clothing or sunscreen, you may be at a higher risk of deficiency. Darker skin tone. Melanin, the pigment responsible for skin color, reduces the skin's ability to produce vitamin D. Therefore, people with darker skin tones may require more sun exposure to generate sufficient vitamin D. Older age. As we age, our skin becomes less efficient at producing vitamin D. Additionally, older adults tend to spend less time outdoors, further increasing the risk of deficiency. Obesity. Vitamin D is fat-soluble, which means it can be stored in fat cells. In obese individuals, vitamin D can get trapped in fat cells, reducing its availability for use in the body. Certain medical conditions like Crohn's disease, celiac disease, and kidney disorders can impair the body's ability to absorb vitamin D from food, leading to deficiency. Medication use. Some medications, such as certain anticonvulsants and glucocorticoids, can interfere with vitamin D metabolism and absorption, increasing the risk of deficiency. Health conditions associated with vitamin D deficiency. Vitamin D deficiency has been linked to various health conditions. These include osteoporosis and osteomalacia. Vitamin D plays a crucial role in maintaining bone health. Deficiency in vitamin D can lead to reduced calcium absorption, weak bones, and an increased risk of osteoporosis and osteomalacia. Rickets. Rickets is a condition characterized by weak and soft bones primarily seen in children. It is caused by severe vitamin D deficiency, leading to impaired bone development. Type 2 diabetes. Some studies have suggested a link between vitamin D deficiency and an increased risk of developing type 2 diabetes. While the exact mechanism is not fully understood, it is believed that vitamin D plays a role in insulin secretion and sensitivity. Cardiovascular disease. Vitamin D deficiency has been associated with an increased risk of heart disease, high blood pressure, and other cardiovascular conditions. It is believed that vitamin D plays a role in regulating blood pressure and reducing inflammation. Certain cancers. Vitamin D deficiency has been linked to an increased risk of certain cancers, including breast, colon, and prostate cancer. While more research is needed to understand the exact relationship, it is believed that vitamin D plays a role in cell growth regulation and immune function. Diagnostic tests for vitamin D deficiency. If you suspect that you have a vitamin D deficiency, it is important to get tested to confirm your levels. The most common test for vitamin D deficiency is a blood test that measures the level of 25-hydroxyvitamin D, 25-OHD, in your blood. The results will help determine if you are deficient, insufficient, or have optimal levels of vitamin D. It is recommended to consult with your healthcare provider to discuss your symptoms and request a vitamin D test if necessary. Your healthcare provider will be able to interpret the results and guide you on the appropriate course of action. Foods rich in vitamin D. While sunlight is an excellent source of vitamin D, it is not always possible to rely solely on sunlight for adequate vitamin D levels. Fortunately, there are various food sources that can help increase your vitamin D intake. Some of the best food sources of vitamin D include fatty fish. Fatty fish like salmon, mackerel, and sardines are excellent sources of vitamin D. Aim to include these fish in your diet at least twice a week to boost your vitamin D levels. Egg yolks. Egg yolks contain small amounts of vitamin D. Including eggs in your diet can contribute to your overall vitamin D intake. Cheese. Some types of cheese, such as Swiss cheese and cheddar cheese, contain vitamin D. However, the amount may vary depending on the brand and type of cheese. Mushrooms. Certain types of mushrooms, such as shiitake and maitake mushrooms, can naturally produce vitamin D when exposed to sunlight. Including mushrooms in your diet can be a good way to increase your vitamin D intake, especially for vegetarians and vegans. Fortified foods. Many foods, including milk, orange juice, and breakfast cereals, are fortified with vitamin D. Check the labels to ensure that the products you choose contain added vitamin D. While these food sources can contribute to your vitamin D intake, it is important to note that it may be challenging to obtain sufficient levels through diet alone, especially during the winter months or if you have limited sun exposure. In such cases, supplementation may be necessary. Vitamin D supplements and dosage recommendations. If you have been diagnosed with a vitamin D deficiency or have limited sun exposure, your healthcare provider may recommend vitamin D supplementation. The dosage will depend on your individual needs and the severity of your deficiency. It is important to follow your healthcare provider's guidance and not exceed the recommended dosage. Vitamin D supplements come in different forms, including capsules, tablets, and liquid drops. It is recommended to choose a supplement that contains vitamin D3 cholecalciferol, as it is the most effective form of vitamin D for increasing blood levels. It's worth noting that vitamin D is a fat-soluble vitamin, meaning it is stored in fat cells and can build up to toxic levels if taken in excess. Therefore, it is important to follow the dosage recommendations and consult with your healthcare provider before starting any supplementation. The importance of addressing vitamin D deficiency. Vitamin D deficiency is a common yet often overlooked health issue. The symptoms can be subtle and easily attributed to other causes, leading to delayed diagnosis and treatment. However, recognizing the warning signs and addressing vitamin D deficiency is crucial for maintaining overall health and well-being. If you are experiencing any of the symptoms mentioned in this article or have risk factors for deficiency, it is important to consult with your healthcare provider. They can assess your vitamin D levels through blood tests and guide you on the appropriate treatment, which may include lifestyle changes, increased sun exposure, dietary adjustments, or supplementation. Remember, your body is constantly communicating with you. By paying attention to the warning signs and taking proactive steps to address any potential vitamin D deficiency, you can optimize your health and improve your quality of life. Stay tuned to your body's signals and prioritize your vitamin D levels. Your body will thank you for it.